Hi, I'm Nick Lolatgis. Look, this is another one of my educational videos, and I'm very proud to be able to talk about the Greek connection. Very, very pleased that I'm sitting here next to a colleague of mine from Athens, Genesis Athens, Dr Kostas Pantos. We liaise and we help each other to help patients achieve the dream, a baby. Recently we had a visit from an IVF nurse from Genesis Athens, Maria Probono, and you'll hear some of her comments a bit later. You'll also hear some comments from one of my patients who went to Genesis Athens, Madeline, and she will tell you about her journey, which is a fantastic journey. And I'm very privileged to be here sitting next to Kostas Pantos, who is the director of Genesis Athens, and we collaborate a lot with my patients, and it's just a fantastic collaboration that we have with incredible success rates.
Yes. I'm very happy to be here with Nick Lolatgis in Melbourne. I'm privileged to be working with him for quite many years. I'm the head of IVF Genesis Athens IVF clinic in Greece. It's the largest clinic the last 7-8 years, and we are doing over 5,000 cycles a year, and we are treating women in Greece and from abroad, from various countries, from 36 countries around the world. And we have been collaborating closely with Nick Lolatgis, both on research fields, on scientific events, but also professionally. Us sending patients to Nick to treat here in Australia, and Nick sending patients to Greece to do IVF cycles, which cannot or will not do here. We have been working successfully together all these years, and I think this collaboration will continue on for quite a while.
This is a fantastic event because I think back to when I first met Kostas Pantos in Paris. It was at a convention and we formed a relationship, and we were able to help Kostas with some technology back in the mid-90s, and I'm very proud of the way Kostas has developed his clinic. It's the largest in Greece and probably the best and most honest in Greece, and I have no hesitation in sending my patients to Athens for donor oocytes, which is the main thing that we do. He trusts me, and I prepare the oven, as we've discussed in the past, and he provides the eggs for these patients. And the testimonials that I have from patients who have gone to his clinic, they explain it as organised Greek chaos, but I just think it's a fantastic service that he provides over there. It's a very busy clinic, but it's all done beautifully and properly, and my patients are very grateful, and a lot of them go back time and time again for other babies to increase their families. I think it's a wonderful service, and the reason I send patients is because donor eggs are very, very scarce here in Australia, and you have to find your own donor, whereas in Athens they have them on tap, a bit like Foster's lager. Isn't that right?
Yes, it is. It is a service which is legal in Greece, which has its own way of. We have our own way of doing it, and we do have great success rates in this. So our performance, our success rates, our working together relationship in introducing new methodologies and scientific ways which we didn't perform in the past. All we do is we strive to have the best success rates to make the dream come true for couples, no matter where they come from Greece, from Australia, from all over. And this good collaboration, this excellent collaboration, brings happiness both to the couples who have achieved their dream, but to us also, seeing these couples have a child in their hand.
And the other thing that that's important is that people think, God, I've got to go to Athens. But the actual cost of going to Athens is comparable to going to America. In fact, it's cheaper than going to America, and having your donor oocyte cycle here in Australia is not much cheaper than going to Athens. Plus, you get a trip to go to the beautiful islands and go to Santorini and Mykonos while you're waiting for your donor to come up. But it's fantastic, and Kostas and I share this ability to trust each other, and we have helped lots of patients, and they, as I said, they give testimonials. Kostas, you give each of these patients, 10 eggs when they come over?
Yes, we usually try and give them 10 eggs, sometimes more, sometimes less, but we're usually around there. We try and fertilize as many as we can. We usually put back in the uterus 2 embryos, healthy embryos, and the rest we do freeze. Greece at the moment is a hotspot for what we say medical tourism, so lots of patients do go to various resorts, to islands, to fantastic beaches that Greece has, and afterwards they leave quite relaxed as far as the whole procedure is concerned.
And of course this is important because we've had other educational videos on the mind and how it's important to feel relaxed and less stressed, and I think this is a part and parcel of our great success rate. I mean, you've taken out the figures, Costas. What have we done in the last 3 years?
The last 3 years we do average around 70% pregnancy rate. This is clinical pregnancy rate per attempt, which is fantastic, and I think it's all about the good collaboration, the way that Nick does with the oven to be ready to accept the embryos, and we try to have as good eggs and embryos as possible to replace back, and we try and do this with a couple of things on our mind, which is first of all trust, good performance, and excellent success rates that we've had all these years.
The other beauty is that the number of patients that are available in Athens to donate eggs is quite high. They're young, and of course the younger the donor, the better quality are the eggs, and I think this accounts for our high pregnancy rates. And I think people that have gone there the first time, they come back and they give testimonials, they convince other patients about the joy in travelling over there and having a 70% chance of a pregnancy, especially as most of the patients that I send to Costas are in their late 30s or early 40s, and 70% pregnancy rate's pretty fantastic.
So we do whatever there is humanly possible to arrive at our excellent result, and we try to get better each year and each time we meet each other. So this is what we have research projects going along to increase this pregnancy rate even further, and hopefully to be able to give some more input into the science of IVF. And furthermore, we've had quite a few world's firsts. One of the recent world's firsts was a grandmother, 67-year-old grandmother, delivering her grandchild in Greece after she had received a court order from Greece. A first for Greece and a world first for this grandmother. So medical tourism at the moment is a field which has been developing quite rapidly in Greece. So we have had a lot of educational programs exported from Greece to nearby countries, and furthermore we have arranged to have meetings in the diaspora from various countries. Recently, about a month ago, we had a meeting in New York where couples spoke about the performance of IVF in Greece, the successful performance of these IVF procedures. And we're also planning to do meetings in Chicago and Montreal. And with Nick Lolatgis here, we're planning a meeting in November in Melbourne. Because we've had quite a substantial number of patients and couples having children here in Australia, I think it's worthwhile that the Homogenia, the diaspora, should know furthermore what the performance of our collaboration has ended to be so successful.
And of course, the other thing that I'll mention now, and I don't want to embarrass Costas, but he's very philanthropic. So he's actually bought a couple of properties close to his clinic, and he has them as hostels for patients who can't afford to stay at a luxury hotel or even a 3-star hotel, and they can stay there for quite a small amount of money. There are shared toilet facilities, etc. But it helps couples who might be finding a little bit tight to get over to Athens for this wonderful treatment that Costas provides at his clinic. It's a huge clinic. You know, here in Melbourne, the biggest clinic does about 4,500 cycles, but in Athens, Costas does 5,100 cycles. And the thing that truly amazes me, let me tell you, ladies and gentlemen out there, is that he does all the transfers himself. That would drive me bonkers, but let alone he does them. It's fantastic.
Yes, I do them because I want to be close to the patient, to the couple as much as possible. I want to say bye-bye to them and, of course, always wish that they will send us pictures. We want to be happy over this. We want to be successful over this. And I'm truly amazed after so many years of working together with Nick Lolatgis. He's the guy that I will only work with from Australia.
One of the ways the clinics work is that we have great communication between our IVF nurses. I employ 2 nurses here in Melbourne, and they communicate with the nurses at Genesis Athens. And without that support, it can be difficult. One of the nurses came out here to Melbourne and spent some time here to work out how we work, and my business operational manager went over them, and I'm planning to send one of my nurses over there to see what's going on. Any comments, Costa?
Yes, I think this was an excellent idea to have an exchange system for our nurses so that they can understand the ways that patients are treated and couples are treated here in Australia, to be able to afford the same facilities and performance in Greece. And also we are going to move on to have an exchange system for biologists too, to keep up the same methodologies both here in Australia and Greece. Our aim always is to have the best performance possible. We do provide various languages, not only English. We have at least 8 languages at the moment in Greece, various people speaking various languages in order to be able to help couples from all around the world. But we are very, very happy that we have all these excellent rates here from Australia.
And I think this is a growing problem for infertile couples, because they're all delaying their families until later on in life, when it becomes more difficult to achieve a pregnancy, and the demand for donor oocytes will continue to increase, and I can see more and more patients going down that pathway, which is the sensible pathway to go down when your eggs are old, or you don't have many eggs, or you have had many failed IVF treatment cycles trying to use your own eggs to achieve a pregnancy. And this is a brilliant outcome for these couples, to be able to have a solution to their problems. There's always a solution. You just have to make your mind up to go down that pathway.